Let's start with a word of prayer. Our dear Heavenly Father, we come again to you as we ask for discernment, asking to help us to better understand these basic, simple laws that you've given us. Lord, help us to put it into our minds that we can retain it and then be able to recall it when we need it. We ask this in Jesus' name, amen. This morning I got a fire call. Someone was driving down the interstate in the number 1 lane, which is the fast lane, ran out of gas and decided just to stay in the fast lane. And didn't, as they run out of gas, pull over. Another vehicle, this is in the nighttime, and came and just plowed right into the car. And so that woke me up at 2 o'clock and thought, well, I have some things to do. So I worked on this. This is a class that we're doing. Our church does something called how-to classes. And what does this have to do with here? Well, it's medical missionary work. And so I put this flyer together. And then I've put a PSA, a public service announcement that I'm sending out later today to all the newspapers and radio stations and those guys. And this is a class, we just did a class on how-to gardening, 101, basic gardening. One of our church members taught it. And we do all kinds of how-to classes. It might be on how to make artisan bread. It might be on how to amend the soil. It might be on how to prune or how to graft. These are classes we've had. To coin collecting, stamp collecting, photography, anything that we can come up with that we can have folks come in and sit in the church for the first time with us. And this is just a basic class. One of our members, who's ever heard of microgreens? And so this is a microgreen class that we'll be having, teaching people about microgreens are rich in antioxidants, potassium, iron, zinc, magnesium, copper, and just a 101 type class. And here I put, let thy food be thy medicine. You've heard that before? Yes. And so as you learn from these classes, whether it's these herb classes, these gardening classes that we're going to be so richly blessed with, take it back to your churches and do how-to classes. Our pastor just left us and went to another church down in Chattanooga. Well, I noticed he's doing how-to classes. Great, excellent. And so I encourage y'all. So we're going to talk about herbs. The herb cabinet. This is a typical Appalachian home in Appalachia. Do they have homes look like that here? Not so much. Okay, this is Appalachian. Cooking herbs, basil, cayenne pepper, cilantro, cloves, fennel, fenugreek, garlic, ginger, nutmeg, oregano, parsley, rosemary. These are herbs that you might be cooking with. Sage, turmeric, and thyme. Where in the kitchen do you not keep your herbs?
Over the stove.
Over the stove, yes. Why? It's hot. Yeah, away from the stove. Yeah. And a lot of people have their spices right there on a spice rack right by their stove, and they will go bad faster. So how can we use herbs? There's a lot of ways we can use herbs, and we're not going to talk about all these today, but these are ways, just kind of an overview. Herbs are food. Herbs fall within the 8 laws of health. And which law do herbs fall within? Nutrition, yes. It's just another form of nutrition that we get nutrients. We just had breakfast. We just had really good nutrition for breakfast. This is another way of getting nutrition. And so you can make teas, and we'll talk about that this morning. Extracts, we'll talk about that this morning. Or you can powderize it and put it in capsules and swallow it. Essential oils. Now, essential oils, we'll talk about that later. They are herbs on steroids. Peppermint, this right here. Can anybody tell me how many cups of peppermint tea you would have to drink for 1 drop of peppermint essential oil? 28. You'd have to drink 28 cups of peppermint of tea to have the same medicinal effect as 1 drop of peppermint essential oil. That's how powerful they are. Then we have poultices. We're going to talk about that this morning and this afternoon, and fomentations. So the herb cabinet. Does anybody have an herb cabinet at home? Really, really important. This is your medicine cabinet. And it's much more effective, I find. The first one's Arnica. Now, these are herbs that are found here in Sweden, I understand, so that's why we chose these herbs. And so we have Arnica. Who's ever used Arnica? What did you use it for?
For skin problems.
Yes, skin problems. It's great for bruising. It's great for pain. I like Arnica. Arnica gel, Arnica cream. So let's look at Arnica. We use the flower. You know, what's it good for? Aches, general aches or aching joints, bleeding, bruises, diarrhea, high blood pressure, hypertension, mouth and throat irritation, muscle soreness, pain. Now let me clarify something very, very quickly here. I don't want to come here and teach you healthy pills. You know what I'm saying? You want to get to what's called root cause. If I have a piece of sandpaper and I'm rubbing my arm, what's going to happen? It's going to wear the hide off of it. And you say, oh, honey, let me put some medicine on there. And you put medicine on there, and when you leave, I go to rubbing it with sandpaper again. Now I'm into the bone. I'm going to eat away on that bone. And you come and you put more medicine on it. Oh, that needed it. It's really bad. And you leave, and I go rubbing it again. That is how we treat allopathic care. We don't get to root cause. And if we're not careful, we can do the same thing with herbs. We're masking and managing. We're not getting to root cause. You've got to stop the sandpaper. So as we look here at hypertension, we'll talk later about hypertension. What are the causes of hypertension? I just don't want to manage hypertension with Arnica. Yes, it may be something in an acute situation to get it down fast, but that is not something you want to be drinking the rest of your life for hypertension. You want to find out the root cause, and we'll talk about root cause of hypertension later. Shortness of breath, stomach pain, rapid heartbeat, tachycardia, and vomiting. Precautions. Pregnant or lactating individuals and children should not take, that's weird, should say women, wouldn't you agree? Can you see how it's changing? Isn't that sad? Should be women. And children should not take Arnica in any form. Individuals allergic to ragweed and related plants, chrysanthemum, marigolds, daisies, who take Arnica may have an allergic reaction. And it's true. Sometimes people who are used, ragweed is one of them we find. People who are allergic to ragweed, we can find some of the herbs that they can't take. They're in the same family. It is also recommended to stop taking Arnica 2 weeks before surgery, as it may cause extra bleeding before and after surgery. Arnica can also trigger increases in blood pressure and heart rate. This is more likely if used in excess or on broken skin. When you look at the side effects, compare these to the PDR for medicine. There's no comparison. No comparison. But you still have to be wise. And there's an excellent book I would recommend that you get. And it's called, who's ever heard of the PDR? Physician's Desk Reference. Sure, you use that as a physician. The PDR. Physician's Desk Reference for Pharmaceuticals. There's also one called the PDR, Physician's Desk Reference for Herbal Medicine. And in that PDR for herbal medicine, just as the one that you used as a physician, it talks about, what's the chemical makeup of the drug, what's the half-life of the drug, what are the indications, what are the side effects, the same thing is true for herbs. And so you can get the PDR for herbal medicine, and it will tell you dosing, it will tell you what part of the plant, it will tell you what to use it for, it will tell you what other herbs not to use it with, and also what medications not to use it with. Excellent tool. So you have to be wise, but we don't see the magnitude of side effects that we see in the pharmaceutical side. Yes, sir?
Where does the information come from? What's the source in that PDR?
That's a very good question. It's also same people who do drugs. It's science-based. I find them to be very, when I say conservative, I would be more aggressive. So what you see there, you can feel safe. I would be more aggressive in using it. And one of the things in herbs, they will say, don't use it for children. Well, or pregnant women. Well, sometimes you don't use it for women who are lactating because it could be, it'll dry them up, and you don't want that to be. But also what we mostly see is saying not to use for pregnant women, lactating women, or young children because there's not research. And I understand not wanting to hurt a child. I get that 120%, 50%, 150%. But you can talk to old people. Like when I was in Africa, I went to the, have you been to Rwanda? And I went to the park. You remember I was talking about the giraffe? Well, we get out and this man, he's the ranger. He said, don't get out in the grass. Because see, at that point, we were 2 hours away from Kigali. And we were going to go in another hour. And he says, if you get bit by a black mamba, you will not live. You will die. And I said, do the old men have antidotes, herbs? And he looked. And he looked. Was anybody listening? He said, yes. He says, they pull about 3 different types of herbs and put it together and you will live. The problem, you got to find the old man and you got to find the herbs. But go to people. If you want to find out what babies can take, nursing mothers can take, who do you ask? A good midwife. They'll let you know. Say someone like a Marianne McNeilis, who's been around a long time, has a lot of experience. Now she's a physician who does midwifery type of things, but ask someone who's older and you can find a lot of information from them. More of an active ingredient can be absorbed through broken skin. On broken skin, Arnica may also cause stinging. So when you put it on the skin, as you had used, if it's a broken skin, you might get a little heavier dosing because it's going through the skin. Yes, you'll get some transdermal, just like you would a nicotine patch or a nitro patch, but if the skin is open, it's going to get in there a whole lot faster. The next one is chickweed. Now, chickweed is, we sell it mostly to women. It's women who want to lose weight because chickweed is an appetite suppressant, And so if you're wanting to lose a few pounds, but you're just always hungry like a horse, well, drink some chickweed tea, and that will take that hunger, extra hunger urge away. The dry herb aids in digestion, appetite suppressant, blood poisoning, boils, breaks down cellulite, breast inflammation during lactation, burns, diaper rash, eczema, eye inflammation. Those are things that you can use chickweed for. Fevers, gout, and again, gout's another excellent situation. We don't want to use chickweed to mask and manage gout. Let's look at the root cause of gout. Take away the root cause, we don't have to deal with the problem. But if you have an acute episode, chickweed's something you can use. Heavy menstrual bleeding, hemorrhoids, inflamed bowels, malnutrition, mouth sores, nosebleeds, poor healing wounds, removes blood vessel plaque, rheumatism, skin disorders, a sore throat. So you can do a sore throat, or you can do a gargle with it. My favorite for it is, and I'll show you in a little bit, is slippery elm. No, I don't think I have slippery elm. Slippery elm is my favorite. Do y'all have elm trees here? Okay, do you have elm trees here? Okay, so you take the bark of an elm tree, bark it, it's just food. The American Indians, they would use slippery elm when they would go from village to village as food, and they'd bark it. George Washington, during the Revolutionary War, for 2 weeks, his men in the winter had no food, and they would just eat the bark of the elm tree. Excellent for sore throats. My favorite for sore throats. Repair tissue, tuberculosis, tumors. No health hazards or side effects are known in conjunction with the proper administration of designated therapeutic doses. And this is from the PDR. Comfrey. Now, who's used Comfrey? Comfrey's one that's a very familiar one. Yeah, leaves, the root, aids digestion, blunt injuries, bursitis, closes wounds. Comfrey is excellent in wound care. My daughter Ashley, she makes a wound salve, and she has Comfrey. She has plantain in it, and some basic herbs in that salve that are just tremendous in healing skin issues. Colitis, feeds the pituitary gland, gastritis, gastrointestinal ulcers, gum disease, hemorrhoids, there we go, there's a hemorrhoid, increased cell production, inflammation, men's broken bones, and that's what we also call it bone knit. Have you ever heard it called bone knit? That's another word for Comfrey. Pharyngitis, rashes, rheumatism, sprains, it's very good for sprains. Stimulates new growth, cell growth, again stops hemorrhaging, strengthens the skeletal system, strep throat, supports rapid healing, swelling, tuberculosis, varicose veins, wound healing. If you want something that works good for this one right here, my favorite for strep throat, it's a simple. Do y'all have golden seal? Okay, but very expensive. It is very expensive. Do you have something called yellow root? Yellow root grows in the mountains of Appalachia. You can't buy it. You have to go find it. It's not something on the market. Very similar to golden seal. It's a Siamese twin to golden seal. But you take golden seal, 1 teaspoon, and 1 cup of tea, gargle for 2 minutes, and swallow every 2 hours. Within 24 to 48 hours, usually within 24 hours, strep throat is gone. Very, very fast. Precautions, lengthy internal use is cautioned for Comfrey. Dandelion. Now, that is food in Appalachia. Who's eating dandelion leaves? Yeah, absolutely, and that is food. Send the children out to go pick the dandelion leaves. The whole plant, the leaves, the root, the seed. Some people use the flowers. Acne, anemia, it's good for a blister, blood builder, blood purifier, boils, or boils, y'all would say. We call it boils. Breast cancer. Now this is really cool. You know, I get excited. I get excited when I see cool stuff. Now, when you see this, you usually see this word. When you see this word, you usually see the herb does this. So when a herb is good for blood purification, that herb is also good to treat cancer. When it's one that's being used for cancer, it's usually good to treat blood problems. Breast cancer, bronchitis, cirrhosis of the liver, colds, corns. It's a good diuretic. It's one of the favorite diuretics out there. Corn silk is an excellent diuretic. Dandelion root and dandelion leaf. Now, if I'm wanting to address, say, congestive heart failure, CHF, and I have a lot of fluid in the lungs, I'm going to use dandelion leaf. If I have a lot of edema in the legs, now you know what edema is, the fluid in the legs, you check for pitting edema. However long it takes to come out, trending is important. And so as it comes out, you measure by the second. You push, for textbook is 15 seconds. Many times it's less than that. But push in for 15 seconds, let out, and you count 1001, 1002, 1003, 1004. For every second it takes to come back out flush. When it flush, you say it was 5 seconds. So we call that pitting edema plus 5. Plus 5. That means it's 5 seconds. So then when you check it tomorrow, 1001, 1002, 1003, 1004, it's +4. Did it get better or worse? It got better. But if it went to +6, it got worse. So trending is very important, where you trend your numbers. You watch, let's say you want to lose weight. You check your weight every day. If it's dropping, 200 pounds, 199, 198, you're trending it. And it jumps up to 102. Whoop, wrong trend, unless you're trying to gain weight. And so trending is very important to know whether you're having improvement as a caregiver, and it's also good to educate the person you're taking care of. Let's say a person comes to you and they have pain, and they're with you for 2 weeks, and they leave and they still have pain. They go, oh, you didn't help me, I still have pain. Well, maybe if you measure the pain when they come in, it might be a 7. And don't argue with people of how much, oh, it's a 10. No, it's not a 10. No way is it a 10, Don't argue. We used to. We were trained to argue with them years ago. And then they're going, no, it might not be a good idea. You're just making them mad. So whatever it is to that person, that's what we're going with. It's a 7. Good. 7. Document 7. And when they leave you, it's a 4. Do they still have pain? Is it better? Then you had improvement. So it also educates you on the trending, is what you're doing improving. Also, it educates the patient that they're getting better too. And many times, this is important in getting better. Maybe I can share a story with you of a neighbor I had that was dying with cancer. So it's a great diuretic. Eczema, electrolyte balance. Why is it so good for electrolyte balance? It's plumb full of nutrients, minerals, very full of minerals. And so it helps with the electrolytes. Hepatitis, high uric acid, improves the tooth enamel. Joint stiffness, it's a good laxative. Lungs, now I should have another one in there. It says lungs infection, but what's another L problem that dandelion is good for? The liver. If you have liver problems, your milk thistle is the best, but right there as a partner, running side by side, I put dandelion root, not leaf, root. Another one that should have fallen in the case is what? Kidneys. Dandelion is excellent for kidneys. Now, the best is corn silk, but running right there, right beside it, along with corn silk, as a partner, is dandelion root. So I use the root for the kidneys and the liver. I use the leaf for congestive heart failure, for the lungs, for the legs. Works very, very well. Potassium rich, promotes digestion, reduces serum cholesterol, stimulates appetite, stimulates bile flow. Now, what if you're doing chickweed and dandelion together? Would it get confused? Stimulates appetite. Chickweed takes away appetite, and your body's going, make up your mind. Do you want me to eat or not? And so watch what herbs you're giving. Watch what they do. Are they doing two different things? Stimulates appetite, stimulates bile flow. It's good for ulcers, valuable survival food. Do y'all have preppers over here? People who are preparing, and so they dig holes in the ground and they do all kinds of things for preparing for a tough time to come. Well, preppers are taught in Prepper 101, one of the foods is dandelion leaf. It's easy to get, it's all over the place, and it's very nutritious. So it's a good survival food. Vitamin A rich, it's also good for warts. I like bee propolis better for warts. Y'all know what bee propolis is? Do y'all have a lot of beekeepers in this area? And propolis is that brown stuff about this color, and the bees use it. This is cool. The bees take it and they stuff it in the cracks to keep the cold out. But let's say you have a mouse that dies. The bees will take and mummify the mouse, and pathogens can't get out of the propolis little mummy thing. Isn't that cool? Yeah, but B. propolis is really good for warts. It's good for sore throats. It's good for the immune system. Propolis is really good stuff. Don't be careful where it comes from. There's a lot of propolis out there on the market. Over 90% of the propolis comes from a country that I don't want to buy from. And so because I just don't trust them. Buy local. You know, find an apiarist, a beekeeper that you trust. Precautions. PDR says no health hazards or side effects are known in conjunction with the proper administration of designated therapeutic doses. So that's dandelion. Dill, the whole plant. That's from the ground up. Anti-cancer, anti-pain, arthritis pain, insomnia, bone health, cholesterol, diabetes. And again, don't use dill to manage diabetes. Figure out what your problem is. 3 major causes of type 2 diabetes. And we'll talk about that over the next 2 weeks. Let's find out the root cause and just reverse it. In the first 20 years of my career, we never reversed type 2 diabetes, never. They actually told me when I left, and I said I was going to an industry that could reverse type 2 diabetes, and they told me I was crazy. That's what corporate told me. Walt, you're crazy. And then I said, we can improve type 1 diabetes. And they looked at me and they said, you are stupid. You cannot do that. Well, yes, you can. But let's get to root cause, not mask and manage. But if you have an acute issue, yes, dill can help with diabetes. Diarrhea, excess gas, hiccups, immunity. In all of these, let's find out the root cause. Increase strength, increase urination, oral health. It's a relaxant, respiratory disorders, stimulates menstruation. According to researchers, dill is generally safe, but in rare situations, it may lead to allergic reactions, vomiting, diarrhea, oral pruritus, urticaria of the tongue. That's like, looks like little sores on the tongue, or throat swelling. People who are allergic to carrots may experience an allergic reaction to dill. And that's up here again, people can have allergic reaction. And you say, oh no, I can't do herbs, they're too dangerous. Well, some people have allergic to cashews, allergic reaction to cashews. Some people have an allergic reaction to peanuts. Some people have an allergic reaction to dairy. I have an allergic reaction to dairy. My gastroenterologist 24 years ago told me I was going to die. Period. You're gonna die. Couldn't figure out what was wrong with me, but I was gonna die. So that's the time to go look for another doctor. I had a wife, I had 3 kids at home, so I went to another doctor that a cardiologist had recommended to me. Guess what my problem was? Dairy. And I grew up on a dairy farm, but dairy was killing me, and I can't do dairy. So people do have allergic reactions to different things. If you got a problem, stay away from it. I will not do dairy. It's not recommended that one uses dill as a medicine during pregnancy or breastfeeding. Use dill on one's skin may cause irritation, or using dill. Some people just have reactions to different things. My daughter, she cannot get around, I don't know if are there any essential oils she can get around?
Maybe like lemon or something.
That's it. Anything else, don't put it in a diffuser if you want her to come by the house, or she won't come in because she has allergic reaction. My youngest son also has allergic reactions to some essential oils, not as bad as my daughter. Drinking dill juice may make one more sensitive to the sun. People with diabetes who are taking lithium. Now this is the lithium, which is a pharmaceutical. It's not the lithium orotate, the lithium aspartate, which I like orotate. It's phenomenal for stress. This is the drug lithium. I had a lady come in a couple of weeks ago. She was taking 1,200 milligrams of lithium a day. That's a mess of lithium. That's a lot. Those undergoing surgery within the next 2 weeks should talk to their healthcare provider before using dill as a medicine. So sometimes it can be an anticoagulant. So if the herb is an anticoagulant, well, that could be good. But if you're going to have surgery, that may not be good. And so you just time when you're going to take it. Elder. elderberries, elderflower. Who's used elderberries? Anybody used elderberries? They're amazing. Elderberries are really cool. They found in Australia the elderberries can prevent a virus from attaching to the side of the lung. Now that's very important. Very important. So you can use the berries, the flower, the bark, the leaves, the stem, the root. The author that I've been quoting a lot, she would plant elderberries at her home because she found elderberries to be really good for you. They're excellent for the immune system. But they're good for allergies, back and leg pain, bronchitis, burns, cholera, chronic fatigue syndrome, colds, coughs, diarrhea. It's a good diuretic. H1N1 swine flu. It's a great antiviral. It prevents cancer, AIDS, and HIV. Induced perspiration if you need someone to perspire. Influenza A and B, it's a good laxative, lowers blood sugar, neuralgia, and sinus infections. Now, does it grow here? It will grow here. Okay, excellent. Do you ever use it? Elderberry? Yeah, that's a great tool to have in your yard and does it take two? Does it take two? But do you have to have two different plants like a male, female? Okay. But elderberry is a tremendous plant, really, really good. Mary Lou and I use it a lot for immune system. You can make elderberry jam and different things. Blood purifier. So if it's a blood purifier, it's not up there. What also could it be good for? Bronchitis, colds, colic. What's the best way to deal with colic for a baby? Breastfeed. Now you'll hear me over the next 2 weeks talk about breastfeeding. When I was in 1969, I was 9 years old. Tennessee was the 4th healthiest state in the United States. Now you're not from the United States, so you don't know the correlation as much as people in the United States. People will go, no way. Tennessee, no way, you were the 4th healthiest state in 1969. Well, it didn't take long. In 2009, we were the 4th unhealthiest state. And that's what people would expect, us along with Mississippi and West Virginia and those places. So Nashville tried to figure out why was Tennessee the 4th unhealthiest state in 2009. Number one, it's what we ate. In 1969, if you went out to eat, you went to Grandma's to go out to eat. We didn't have the restaurants and stuff. One, we didn't have it. Two, we couldn't afford it, especially mountain folks. And you went to Grandma's, you went out to eat. In 2009, folks didn't eat at home hardly. They ate out all the time, and junk food. Number two, what were people drinking? In 1969, water, lemonade, Tang. Remember the astronauts drank it, so it must be okay. Not the healthiest for you. But still, it was better than the volume of what we started drinking. If we drank a soft drink in 1969, it was just a little old bottle, not big. In 2009, we were drinking what's called gulps. And you can get refills and more refills, as much as you want, as long as you're at the restaurant, just keep filling up. I had a guy come in last year, he had diabetes. And I asked him, I said, what do you drink? How much water do you drink? He said, I don't do water. I said, well, what do you drink? He says, Mountain Dew. I said, well, how much you do? He said, 3 liters a day. 3 liters a day. No wonder he had diabetes. And so in 2009, we were the 4th unhealthiest state because of what? We were drinking. Number 3, exercise. In 1969, I was riding my bicycle. I played a lot of softball back then. I was running, I did chores, I was active. In 2009, where were kids? Inside doing video games at that time. They didn't have the phones as much then. They do now. But in 2009, they were inside playing video games. They weren't exercising. And what do you think number 4 was? The lack of breastfeeding. Breastfeeding is huge. Very important. And so a girl will come in and they'll have, maybe have colic, they'll have croup, and I'll say, do you breastfeed? No. It's exactly what they tell me. That's gross. That's exactly what they tell me. That's gross. My girlfriends don't do that. Why would I want to do it? And breastfeeding is so important for the immune system, for the bone health, for the digestive health. Now they're finding for cardiac health as we get older. Breastfeeding's huge. 2-3 years is what's recommended. Yeah. And later maybe I'll tell you about how to increase the IQ 10 to 15 points above the mother's IQ. Really cool. America did the research. Germany is now following up with the research and finding even higher than the American research. Maybe we can talk about that. But breastfeeding is part of that. Constipation detoxifies body tissue at the cellular level. Diabetes, it's a good diuretic, increases blood circulation. That is key. We talked about that. Was that last night? Perfect health is perfect circulation. Very, very important. If you don't have good perfusion, right, Doc? Gotta have perfusion. Any of y'all guys, car guys? Y'all like cars? Anybody car guys? Oh, you like cars? Okay, so do you know what a Hellcat is? A Dodge Hellcat. Okay, so I have a customer who bought a Dodge Hellcat. Had it, fixed coming from the factory. It was 800 and some horsepower. First gas tank on the computer said he had 2-point-some miles to the gallon. When he got up around 300 miles, he just decided the car just ain't fast enough. So he sent it to Randleman, North Carolina. Anybody know who lives in Randleman, North Carolina? Has anybody ever heard of a man called Richard Petty? Okay, I'm a little ways from home. Richard Petty is the king of NASCAR. And he sent it to Mr. Petty. Mr. Petty totally ripped that car apart. 300 miles is always on it. Put a deeper oil pan. He put in 2 fuel lines, 2 fuel lines, 2 fuel pumps, 3/4 of an inch in size. You're smiling. It's going to be a fast car, huh? He took first gear out because it just squalled its tires. It was so fast. It had 1,500 horsepower, 1,500 horsepower. Mr. Petty told him, no longer can you buy gas at the gas station. You need 115 octane. Y'all know octane percentage? 115 octane. He says, you now have a race car. Gas station, gas will destroy your engine. So what if they had built this car and Mr. Petty, I doubt they have Pintos there. Y'all know what a Pinto is? Anybody? It's a real little car, dinky car, or as we call it, a danky car, little. What if we put the fuel line from that car on there? Or maybe an old English Ford. Y'all remember the English Fords? That was a little car. We had one of those when I was a kid. What if you put an English Ford fuel line on there? It might idle. I'm not sure. But if you step on it, what's going to happen? It's going to stall. You've got to have good circulation. And that's what happens in our bodies. If we have poor perfusion, atherosclerosis, you're not going to have good perfusion and your body stalls, especially your heart. And your heart starts screaming, stop. Well, elderflower helps to improve circulation. Inflammation, laryngitis, pain, promotes sweating, red eyes, reduce fever, release pain, rheumatism, sedative action, shortness of breath, sinusitis, stops bleeding. Precautions, only fully ripe purple berries are to be used if it's elderberries, as red berries can be mildly toxic. So make sure that it is the ripe purple berries, not the red berries. The other is eating uncooked berries can result in diarrhea and vomiting. Well, when we make elderberry, which is right here, elderberry extract, they have been dried, and then we are going to process them. Some people cook them, and that then will make them where they won't be a problem. Hops. Y'all have hops? Some people are telling me I can't do hops. And then we live in the Bible Belt and a lot of Baptists, and it's not looked well on Baptists to drink. And so they're afraid that if they take hops, they'll get drunk. Well, hops won't make you drunk. It's just a product in the beer. Hops, people used to take hops, and when they would make a little hops pillow, make a little smaller pillow like lavender or hops, put it underneath their other pillowcase and sleep on it and breathe the hops or breathe the lavender flowers. And hops is great for sleep. But hops is an item, flower or the leaves. Anxiety. Y'all have a lot of anxiety in this area? Since COVID, our anxiety has gone through the roof. It has. I have a friend who's a neurologist, specializes in brain function, and he tells me that it's just getting worse and worse and worse and worse. Anxiety, huge. It's an appetite stimulant for bedwetting, bronchitis, calms and soothes the body, curbs alcoholism. See, actually, it's going to help that person. Yeah, it's kind of interesting that that would be in beer. DTs, delirium tremens, digestion, dizziness, excessive sexual desire. Gonorrhea helps reduce pain from a toothache, hyperactivity, so it'd be good for the kids instead of Ritalin. Hysteria. No one's here from Romania, are they? So we were in care plan one time, and this patient just comes in. We were doing the care plan on a patient, and we finished the care plan, and our new nurse that was in charge, she said, "You can talk about biting them." And I said, "What do you mean?" She says, "You didn't say to bite them." No, we don't bite people here. She was from another country. She's from Romania. And I said, "What are you talking about?" She says, "Well, if a patient is having a grand mal seizure, we bite their finger. Take our lab coat and put it in and wrap it around it and bite their little finger, and it will stop the grand mal seizure." No, we don't do that here. And I'm thinking, let's move on. Well, then out of the back behind me, one of my therapists, who's from Korea, said, "You don't bite people?" I'm thinking, what have I gotten into here? And I said, "What are you talking about?" She says, "Well, we bite people for grand mal seizures in South Korea. You don't bite them here?" No, we don't bite people. And I just left it at that. No, we don't bite people here. We'll get in trouble. And so you know what locum tenens is? That's when a doctor comes in and does some work for you short term. Well, we got two doctors, Dr. Gabriella Tolan and Leslie Tolan, the husband and wife team from Romania. And they came to the office to introduce themselves and for me to introduce myself to them and give them their directives. And I wanted to find out, you're from Romania? What do you do if a person has a epileptic seizure, a grand mal seizure? Right at both of them like they're in the choir. Bite them. I said, "Are you serious?" "Yes, that's what we do." I'm going, oh, wow. Okay. So I'd moved back to Tennessee, and I have a good friend. He's a physician from Germany. No one's from Germany here, huh? I said, "So they do this in Romania. What do you do in Germany? Do you bite them?" He goes, "No, we're not that barbaric." He says, "We just take our finger and we grab their earlobe and crank it down as hard as we can. And we get their little pinky and we take the other hand and crank it down as hard as we can. That's how we stop it." I'm thinking, wow. What it does is if they're in an epileptic seizure, it doesn't work for a brain tumor, but the brain's going, it goes, "Whoa, what was that? What just bit me?" And it takes its attention off. Does it make sense? Yeah. So how did I get into this? There was something here that made me think of that. Yes, hysterica. Yeah, thank you, remembered. So the doctor, Dr. Gabriella, who's a lady, she said that's also what we do to ladies in hysteria. She says, in America, you slap them. Well, I guess she's watched some old movies or something, you know, from the 60s. But she says if a lady's in hysteria, we just bite their finger and it brings them out of the hysteria. Yeah. I'm not teaching biting, not at all. We use hops for hysteria. Insomnia, problems sleeping, and there's a lot of problems with sleeping. Hopefully I'll get to talk about sleeping problems and what's some big issues that you can do there. Intestinal cramps, menstruation, morning sickness, nervousness, neuralgia, prevents infections. Reduces fevers, relieves pain, relieves pain of the facial neuralgias. Who's ever heard of trigeminal neuralgia? Trigeminal neuralgia. They would have a hard time here today going outside because the cold is just so painful, so painful. They can't touch it even. Let's see here. Ringworm, sciatica, sedative effect. It does have a sedative effect. Soothes boils, soothes inflammation, source of niacin, urinary tract infections. My favorite for urinary tract infections, one, you want to figure out the cause. Men and women are built different, so therefore women are more prone to. Number one, drink water. That's a big issue. As one doc told me years ago, he said, Walt, first thing I look at, do they drink dark soft drinks? The Coca-Colas, the Dr. Peppers, the Pepsis, the dark ones are more prone to give the UTI. The clothing can affect it. The tightness of clothing, the breathingness of clothing. Does it breathe well, or is it, what's the material made out of for ladies? And cleanliness. So how do we deal with UTIs? The best thing I found is something called D-mannose. Have any of y'all ever heard of D-mannose? D-mannose is, I'm looking at the hour. I don't have an hour, I have only 48 minutes. I've gone past. So I'll finish with this. D-mannose comes from cranberries. It's very, very potent. Just like allicin comes from garlic. It takes 28 cloves of garlic to make 1 drop of allicin. Or bromelain, where it takes a bunch of pineapple to make bromelain. Well, D-mannose is the chemical that's in cranberries and blueberries that works to get rid of urinary tract infections. And so what it does is you take the D-mannose, 1 teaspoon every waking hour during a problem with any type of urinary tract infection. And it works like a magnet, and it the E. coli and the bacterial just love to eat it. But here's the problem. If you don't force fluids, they'll eat it up like birthday cake. And 2 hours later, give them another teaspoon of it, and they go, more birthday cake. And they want more because it really tastes good to those guys. And they'll just keep eating it, and then they'll just get bigger and more of it. So you got to force fluids, and force fluids, you're going to urinate out the D-mannose. It's like a skunk. Do you know how a skunk gets rid of fleas? Y'all got skunks here? You have skunks? Some say yes, some say no. A skunk stinks, it sprays. It's got a white mark down its back. You don't have it? Okay, that's a good thing. Okay, yes, absolutely. And so a skunk will have fleas. And so what it does, it gets a big mouthful of grass in its mouth. It goes to still water. Slowly, slowly backs down in the still water. Very slow. The white stripe turns black. Slowly, slowly it backs down. Until finally the nose is sticking out. That's all. And then it lets go of the grass and swims out, and all the fleas are on the grass. Isn't that pretty smart? God teaches his animals, doesn't he? Well, that's kind of how D-mannose works. It collects all the E. coli, all the bacteria, and then you have to urinate it out, and it carries it out. And so you have to force fluids. And then you give another dump truck in 2 hours, a teaspoon of it, and that dump truck hauls it off, and you keep doing it. So it works for urinary tract infections. It works for interstitial cystitis, IC. Who's heard of IC? It's a problem in the bladder. And also something called honeymoon syndrome. Works well for that.